Firstly, select an appropriate probe and perform 2D imaging to obtain the target image. Select the Contrast button to enter the contrast imaging mode. It will turn on the Dual Live function automatically. Then the screen displays both the tissue image and the contrast image. Make sure to finish the parameter setting before injecting the agent into the animal to avoid affecting image consistency. Parameters in contrast mode are similar to those in B mode, such as gain, depth, dynamic range, persistence, eye clear, smooth, gray map, and tint map. MarkLine can synchronously locate the position of the target on the tissue image and contrast image so as to facilitate the observation. In the main contrast interface on the touchscreen, we can also adjust the conventional parameters. In addition, in the subcontrast interface, select Position of Contrast Image to change the position of the contrast image and tissue image, and also change the form of image display through flip vertically, rotate, and flip horizontally. The subcontrast interface allows the selection of contrast agents, and here we set up the two most commonly used contrast agents, SONAVUE and SONAZOID, which can be selected according to the type of contrast agent. Make sure to adjust the duration of ProCapture or Retro Capture according to the contrast duration in the Sign interface for video acquisition. After the parameters are adjusted, we can start the process. During the operation, fix the probe in the section of interest. Avoid moving the probe or adjusting the parameters as far as possible to avoid the subsequent quantitative analysis. To start contrast, we need to inject the contrast agent through an IV catheter. Select Timer 1 and ProCapture at the same time. You can perform several live captures if there is more than one interested selection. If several captures are required, activate the destruction function by setting Destruct to destroy the microbubbles left by the last contrast imaging, so as to observe the reinfusion. For every single contrast imaging procedure, use Timer 2 for timing. After video acquisition, we can use the following post-processing functions. First, select the video segment of interest by sliding the trackball to Set Begin and Set End. Select Save, open this video, and click the Mix Map button to mix the contrast image with the tissue image, which can help the physician locate the anatomical position of the interested contrast region in the tissue. Gray map, tint map, and mix map can be selected for viewing. Microflow enhancement, MFE, can also be performed on the interested contrast video. Select MFE to start the function and use MFE period in the parameter menu to select different imaging period which is suitable for current flow and get the best imaging effect. Contrast imaging quantitative analysis is provided in VITAS 9. Contrast imaging QA adopts time intensity analysis to obtain perfusion quantification information of velocity flow. This is usually performed on both suspected tissue and normal tissue to get specific information of the suspected tissue. Perform the following procedure. Select a desired sign loop from the stored images and review the image to a desired frame. Select Contrast QA to activate the function. Move the trackball to the sample area. Select Trace ROI or Ellipse ROI on the touchscreen to mark out the interested part, ROI, and determine the sampling position by moving the trackball and clicking the Set button. Up to 8 ROIs can be saved on the reference image, with the corresponding 8 traces plotted simultaneously on the graph. Each ROI display has a different color, and its corresponding trace data is plotted using that same color. Press the Clear button to clear out the last ROI. Select Copy ROI to create a new ROI similar to the current or latest added ROI. Move the cursor to the inside of any ROI. Press the Set key to drag ROI to the target position, and press the Set key to fix the ROI position. Select Delete All on the touchscreen to clear out all ROIs. If ROI tracing is completed, select Fit Curve to turn on the curve fitting function. Select Set Fit Start and Set Fit End to set the fitting curve range. Select Raw Curve on the touchscreen to hide or display the raw curve. And select Table Display to check the relevant parameters. Parameters include GOF, Goodness of Fit, calculate the fit degree of the curve. Range 0 to 1, where 1 means the fit curve fits the raw curve perfectly. BI, Base Intensity, basic intensity of no contrast agent perfusion status. AT, Arrival Time, time point where contrast intensity appears. Generally, the actual time value is 110% higher than the base intensity. TTP, Time to peak, time when the contrast intensity reaches peak value. PI, Peak Intensity, contrast peak intensity. AS, Ascending Slope, ascending slope of contrast, the slope between the start point of lesion perfusion to the peak. DT/2, time when the intensity is half the value of the peak intensity. DS, Descending slope of the curve. AUC, area under curve, to calculate the area under the time intensity curves during contrast. MTT, mean transition time, the mean time which a red blood cell microbubble needs to flow through the tissue mass. Use X-scale on the touchscreen to choose different values, so that the X-scale display manner will be changed to track detailed tissue information. After adjustment, click the Save button to save the curved image. Select Export. Select the drive and enter the file name in the displayed window. Then select OK to complete the export operation. All displayed ROI traces are saved in the exported file. Then the current screen image is exported and also includes the analysis data and parameters of the curve. Select Exit to exit Contrast QA. Press B button to exit Contrast Imaging function.